When it comes to losing weight, especially in an effort to address serious health concerns, it can be confusing and even tough to know what are the best options for your specific circumstances. So this morning, we are exploring both surgical and non-surgical paths to weight loss, options that can mean real and lasting results. Dr. Lauren Rabach is from Dignity Health. She is a gastrointestinal surgeon. She specializes in bariatric surgery. Dr. Rabach, good morning to you. We've been having a great conversation. Help us understand medical weight loss and bariatric surgery, the difference, and really how they work together.
So we at Dignity Health say that both of them are very much complementary. Medical weight loss targets nutritional and dietary counseling, behavioral therapy, lifestyle changes, as well as FDA-approved medications.
Okay.
And that is complementary to bariatric surgery, which aims at physical changes to a patient's digestive system, which targets their ability to eat, as well as their overall metabolic hormones in their body.
So in other words, with your program, you don't do surgery and then say goodbye and that's that. You really come alongside people for the entire journey. Is that right? Am I characterizing that correctly?
Absolutely, yes. We at Dignity Health want to provide support not only at the time that we meet them for initial consultation, but throughout their journey as they lose the weight and maintain it long term. We want them to be our patient for life.
And on that note, we were talking about how this is a disease, right? I mean, this has to be a multi-pronged approach. Talk to me about how your program addresses that and doesn't just, give somebody one solution and then that's it.
That's important. I think obesity, what we want to address is that it is a chronic disease process, something that requires a very comprehensive multidisciplinary approach. Because it will be something that the patient will have to work to achieve and maintain their weight loss forever. Almost like diabetes or high blood pressure. It's a chronic disease process.
So let's address bariatric surgery. Who exactly is a good candidate for something like that?
Great question. So patients with a BMI or body mass index of greater than 40 qualify, as well as patients with a body mass index of 35 with one medical related condition, such as high blood pressure, diabetes, obstructive sleep apnea. But I think what's important to note is recent changes to our clinical guidelines have lowered those thresholds. And so anybody that is unsure or wants to hear more information, I recommend seeking personal consultation for that.
Dr. Rabach, let's bring this conversation full circle. A lot of people might think of bariatric surgery as a quick fix, but help us understand, as a medical doctor, how you ensure that there's long-term success. Because as you said, this is a disease. This isn't something that you're gonna snap your fingers, have a surgery, and be done.
Well, I think number one, preoperative education is very important. Having the patient understand that we are a supportive environment, that they're not only the surgical aspect, but the dietitians, the psychologists, our mid-level providers, we're all kind of focused on the same goal. And that is making sure that the patient is achieving the successes that they want to with their weight loss. And so that requires long-term care. And so that I think is really important for the patients to understand.
And I feel like that exact solution, the long-term care, provides people hope who have for so long felt hopeless fighting the disease of obesity. Thank you so much for this important conversation. Really appreciate it. Dr. Lauren Rabach from Dignity Health. If you want more information, we will put up the phone number as well as the website where you can contact the folks at Dignity Health.